Okay, tonight we're going to do a nose, mouth, and throat assessment. And first, I will do a room scan. And that's where I will put my computer with my gloves, tongue blade, and pen light. Okay. So I'll ask my patient a few questions regarding his nose, mouth, and throat. So, Mr. Michael, do you know if you have any sinusitis lately? Did you experience any sinusitis?
No.
Sinus pain? Here?
No.
No. Did you experience any like abnormal discharges in your nose?
Discharges?
Yeah, like
No.
no. How about your throat? Did you experience any hoarseness of voice?
No.
Difficulty swallowing, sore throat? And how about your teeth? Did you experience any bleeding in your gums?
No.
And how often do you go to your dentist?
6 months every.
So irregular. Okay. So first I will start assessing his nose. So I will inspect his nose for the symmetry, deformity, and skin lesions or inflammation. And then I will inspect for the nasal septum if there is any deviation, and it's in the midline position. I'm also checking the size or the shape of his nares. It's equal. And I will now check the patency of his nostrils. Can you please cover one of your nostrils and sniff inward? Other one, switch. Any problem with that? Did you experience any obstructions? No. And now, can you please come forward? I will palpate your frontal sinus. Okay, I will put a firm a pressure. You feel any pressure?
Yes.
Okay, and pain?
No.
Okay, and then now I will go to your maxillary sinus just below the cheekbones. Feel the pressure, but no pain or pain?
No.
Okay.
No pain.
So that was assessing the nose. And now I will proceed with his mouth and throat. Checking his mouth, I'll first start with the lips. For the color, it's pink, moisture, any cracking or lesions. And then I will check his teeth. I will use some gloves here for hygiene purposes. Okay. So can you please open your mouth? Checking the teeth. Thank you. I was checking, noting if he has any diseases, like gingivitis, gum diseases, and I was also checking if he has abnormal position teeth, missing teeth, or loose teeth. But looks like he has complete teeth, and there are no missing teeth, and there are no loose teeth. Then I will check the gum margins. Can you please come forward? So I was checking the gum margins if it is well defined, and if the gum margins are tight. I'm checking for discoloration, for any bleeding, but looks like there's none. Thank you. And now I will proceed with, can you please smile and show your teeth? Thank you. Okay, so I was checking the symmetry of his mouth and his lips. And now I will check his tongue. Can you please come forward? His tongue. I will use this is my tongue blade. Tongue, thank you. And pull your tongue up. Thank you. Thank you. So I was checking his tongue for the surface characteristics, the color and the moisture. And I was checking the dorsal surface of his tongue. It was pink and rough and a little bit of white patches, and I think that's from his taste buds. And I was also checking the dorsal surface of his tongue. It was super shiny, very shiny, and a lot of veins. And can you please come forward? Now I'll check the floor of his mouth. Okay, so it's evenly pink. I don't see any white patches or nodules. Any lesions? No. And then I will also check the buccal mucosa. I see a little bit of white patches, but that's normal. And it's even pink. Okay, I don't see any lesions or inflammations. And then now I will check the roof of your mouth. Okay. And the hard palate is white and has some irregular rugaes in it. And now I will check the soft palate. That was checking the hard palate. Now I'll check the soft palate. And as I will check his soft palate, I will also check the uvula and the tonsils. Can you please wide? Thank you. And I was checking the soft palate. It's pink, smooth, and it moves upward in an upward manner. And then his uvula is in midline position, and the tonsils are not enlarged. It has deep crisp, and I was also checking the size. It was +2. Normally it's +2, and then so I checked already the uvula and the tonsils. So now I will check the cranial nerve number 9 and 10. So I will ask you to say ah. Can you please come forward? Say ah. Say it again. Ah. Okay, there you go. Thank you. So I can see the soft palate and the uvula rised up when he said ah. That was checking the cranial nerve number 9, the hypoglossal, the glossopharyngeal, and the cranial nerve number 10, the vagus nerve. And then now, lastly, I will check the cranial nerve number 10, which is the hypoglossal nerve. So I will ask you to stick your tongue out, that back. Thank you. So I was checking if there's any deviation or and if it's in the midline position. And with that, that was checking the cranial nerve number 12, and that's also one way of checking if there's any neurological impairment or damage. So that ends our nose, mouth, and throat assessment. Thank you.